Hello, I'm Dr. Brandt R Gibson, and I want to talk to you about heel spurs. And the idea here is a lot of times people were worried about heel spurs. They were told by their doctor they have a heel spur. And I want to help you understand when it is important and when it really isn't a big deal and not. So, heel spurs are common in the foot. They actually can be seen in a lot of individuals. And there are three distinct parts of types of heel spurs that you all actually know and how they should be treated and so forth. So number one, the most common that people hear about is the heel spur on the bottom of the foot. They're saying, okay, I have pretty significant heel pain. Anytime I step down, I get severe pain, and they go in and see their doctor. The doctor says, oh, it's because you have a heel spur. Now, the truth is this heel spur, as you can see, is parallel to the ground. It does not cause pain. The heel spur itself doesn't need to be treated. You're going to treat the symptom, which is the plantar fasciitis, not the spur itself. So a heel spur in this area doesn't need to be treated. If you treat the plantar fasciitis, you can actually alleviate that problem without even touching the heel spur. We used to do surgeries on these. We used to go in and take out the heel spur. And what we found is we were actually cutting the plantar fascia and solving the problem because it was the plantar fascia that was tight that was actually the issue, or plantar fasciitis. So if you want additional information, go look for plantar fasciitis. We can actually give you the ways you can actually a plantar heel spur, a spur on the bottom of the foot, does not need to be treated. Number two is a spur that's actually in the Achilles tendon. This is the spur right here. You can see it. The Achilles tendon comes down right here, and it attaches in that area. And the spur will actually sit inside the Achilles tendon. So it causes pretty significant inflammation, pretty significant pain. And you're going to have pain right in the back of the heel. So you'll actually get pressure right in that area, and it will cause pretty significant pain, pretty significant discomfort. And because of that, these spurs do cause problems. They do need to be treated. The way this is treated, you actually go into the back of the heel. You'll split the Achilles tendon, open it up, clean out the spur. So basically you would cut it off right here, and you'd leave the Achilles tendon attached and clean it out. And then you'll usually drop a couple of anchors in the calcaneus that holds that Achilles back down while it and to reattach the heel without that spur inside the Achilles tendon, causing all that pain. This is a very common one. This is usually causes pretty significant pain, and a lot of times it does need to be treated. Now, if you have some discomfort in that area and you're saying, okay, I'm not ready for surgery yet, there are three additional ways you can treat this. One is by doing Mls Laser to the area. The advantage of the Mls Laser is it decreases pain, decreases swelling, excuse me, and it stimulates the area to heal. So by doing this, you're actually improving the inflammation in that Achilles tendon. It can alleviate it, and then you may at least be able to buy some time to not do the spur immediately. And they can actually cause a rupture, which is a lot bigger problem than the spur. But you can do anti-inflammatories. You can do ice the area. You can do heel lifts to take the pressure off the Achilles tendon. All of those will help. They're treating the symptoms. They're not treating the cause. The third is sometimes not thought about, and that's the bump on the back of the heel that we call Haglund's deformity. And what it does, it sticks out usually on the lateral side, on the outside of the heel, and it will push on the Achilles tendon from the underside. You can also get pressure, say, from a shoe or a boot or something like that in that area. It pushes on that area, and it will cause pretty significant inflammation and pain. And it's usually palpable. You can actually feel it from the outside. You say, okay, yeah, there's a bump here. A lot of times that could be the Haglund's deformity. The advantage of the type of spur is it's not in the Achilles tendon. It doesn't affect the Achilles tendon directly. The Achilles tendon sits right behind it. And so a lot of times we can do an incision from the side. We can actually do a cut, and you actually just take that bump off and solve the problem. And so typically you can take that off without affecting the Achilles tendon. You can get back to normal shoes quicker, usually just a couple weeks. You can get back to doing normal activities and so forth. So three types of heel spurs. The plantar heel spur, or the spur on the bottom of the foot, does not need to be treated. The retrocalcaneal, or the back of the heel spur that's inside the Achilles tendon, does need to be treated. It's usually a big deal because you have to split the Achilles tendon to do it. And the Haglund's deformity, which is a spur on the top of the heel bone and usually on the outside of the heel, sometimes outside of the ankle, depending on how you want to look at it. That also can be treated. It is a lot easier surgery if it needs to be done. Factory tips day 342, heel spurs and the treatments you can do for heel spurs and those deformities. If you would like additional information, if you say, okay, this is great, but how do I know which spur mine is? It is best that you get an x-ray and it can be evaluated. If you'd like to go to utahfootdoc.com, we would be happy to see you or help you in that way. Or you can just reach out to me in the comments below and say, here's what's going on. How do I get some help? This is Dr. Brandt Gibson. I'd love to help you. If not, thank you. Have a great rest of your day. Maybe.